In this training, we'll discuss what is an opioid, types of opioids, how to recognize an overdose, how to respond to an overdose, tips for preventing an overdose, and suggested resources for family members, friends, and loved ones. This graphic shows the number of drug overdose deaths involving any opioid among all ages separated by gender between 1999 and 2017. You can see from the graph that the number of drug overdose deaths have increased from 8,048 in 1999 to 47,600 in 2017. This graphic shows the number of overdose deaths involving opioids in Maryland broken down by opioid category. While overdose deaths involving prescription opioids and heroin have decreased since 2016, synthetic opioids, which includes fentanyl, have increased. Opioids are derived from opium and extracted from the seed pod of certain varieties of poppy plants. They can be natural or synthetic. Opioids can be obtained with a prescription or illegally. They come in different forms, like a pill, capsule, powder, patch, or liquid. Opioids can be swallowed, smoked, snorted, or injected. The effects of opioids may cause feelings of euphoria, contentment, or detachment, causes extreme physical dependence. Short-term effects can last from 3 to 24 hours depending on the kind of opioid and how much was used. In excessive amounts, opioids suppress a person's urge to breathe. Types of opioids. Opioids are used to treat moderate to severe pain and are often prescribed following an injury or surgery. Certain opioids are also used to treat opioid use disorders. What is fentanyl? It's 50 to 100 times more powerful than morphine. It's medically prescribed as transdermal patches or lozenges. It's approved for treating severe pain. It's a synthetic opioid pain reliever. Illicitly made fentanyl. Overdoses associated with fentanyl have risen dramatically, contributing to the sharp spike in overdose deaths. Fentanyl is often mixed with heroin or cocaine, with or without the user's knowledge. Heroin is an opioid drug made from morphine, sold as a white or brownish powder or a black sticky substance. Pure heroin is a white powder that can be snorted or smoked. Black tar heroin is sticky like roofing tar or hard like coal and is dissolved, diluted, and injected into the veins, muscle, or under the skin. Lethal doses. This graphic shows the amounts of heroin, fentanyl, and carfentanil that are considered lethal doses. It's important to remember that every person reacts differently to these substances. How to recognize an opioid overdose. An opioid overdose occurs when opiates overwhelm certain receptors in the brain, causing breathing to slow dangerously or completely stop. Many opioid-related overdoses result from mixing prescription painkillers or heroin with benzodiazepines, cocaine, and/or alcohol. What leads to overdose death? Respiratory failure, organ failure due to lack of sufficient oxygen. Signs of an opioid overdose: slow, shallow breathing or not breathing at all, pale, clammy skin, loud snoring or gurgling noises, a limp body, slow or erratic pulse, blue lips or fingertips, the person is unresponsive or unconscious. How to respond to an overdose? First, try rousing and stimulating the person. Then call 911. Then give the naloxone. You may need to provide further resuscitation, and then you're going to care for the person. Step 1. Make noise. Shake the person's shoulder and yell, "Hey, are you all right? Wake up!" Stimulate pain. If there's still no answer, do a sternal rub by making a fist and rub your knuckles up and down the breastbone. Step 2. Call 911. And why should you call 911 before administering naloxone? The person may have complications or other health problems. And naloxone is only temporary. An overdose can reoccur when the naloxone wears off, even if the victim has not used opioids again. You may need to give additional doses of naloxone. And it may be a non-opioid overdose situation. Naloxone is only effective in reversing opioid overdoses. Step 3. Give naloxone. What is naloxone? It reverses opioid overdose by restoring breathing. There's no potential for abuse or getting high. There's no effect on someone who hasn't taken opioids. There's minimal side effects. It's safe for children, pets, and pregnant women. It can be given intramuscular, intravenous, or intranasal. It wears off in 30 to 90 minutes. It's only effective in reversing opioid overdoses. How to administer naloxone. Step 1. Open the blister pack found inside the box of Narcan. Step 2. Place your thumb on the plunger. Step 3. With the person on their back and their chin tilted slightly upward, insert the tip into either nostril. Step 4. Push the plunger with your thumb until it no longer moves. Give a second dose if the first dose doesn't work within 1 to 3 minutes. Continue resuscitation as necessary. How does naloxone work? Naloxone knocks the opioids off the receptor. Naloxone binds to the receptor, blocking the effects of the opioids. Breathing is quickly restored. Effects of naloxone. Administering Narcan may cause a person to feel physically ill or vomit, experience withdrawal symptoms, which can be unpleasant but not life-threatening, become agitated and upset due to the withdrawal symptoms, have a seizure, though this is rare. Storage and disposal of naloxone. Store naloxone in original package at room temperature and avoid exposure to light. Keep in a safe place away from children and pets, but easy to access in case of an emergency. Naloxone loses its effectiveness over time. Check the expiration date on the label. And check with the local health department or pharmacy about properly disposing of expired medications. Step 4. Further resuscitation. Give rescue breaths. Lay the person on his or her back on a flat surface. Tilt the chin to open the airway. Remove anything blocking the airway. Pinch the person's nose completely closed. Cover his or her mouth with your mouth and blow 2 regular breaths about 1 second each. Breathe again and then give 1 breath every 5 seconds. If trained and person has no pulse, you can begin CPR. And follow the 911 dispatcher's instructions. Step 5. Care for the person. Stay with the person until medical help arrives. If they are unable to sit up, put the person into the recovery position. Keep the person calm and encourage them not to take more opioids. If overdose reoccurs, give another dose of naloxone. Now let's see what it looks like to put all the steps together.
Hi, my name is Elizabeth and I'm Health Education Specialist at the Worcester County Health Department. I'm here today to talk to you about how to administer Narcan in the event of an opioid overdose. One of the first things we're going to talk about is what is an opioid overdose. So an opioid overdose occurs when opioids overwhelm certain receptors in the brain, causing breathing to slow or stop. One of the first things that you'll want to know is some of the signs of an opioid overdose. So we're going to go over that with you today. Some of the signs include slowed or shallow breathing or no breathing at all, pale, clammy skin, loud snoring or gurgling noises, a limp body, slow or erratic pulse, blue lips or fingertips, unconscious or unresponsive. So how to respond to an opioid overdose? Step 1 is to rouse and stimulate the person. So what you'll want to do is get their attention, yell at them, shake them. Hey, are you okay? Wake up. If this individual doesn't respond, what you'll want to do is stimulate pain. To do this, we recommend a sternal rub. So you're going to make a fist, take your knuckles, and rub it down the person's breastbone. Step 2 is to call 911. The reason you want to call 911 before administering Narcan is because you want to get help on the way right away. This individual might not be suffering from an opioid overdose, so you want to get help on the way. Another reason being is because naloxone or Narcan is only temporary and can wear off. and you might need to give additional doses of Narcan. Step 3 would be to administer the Narcan or the naloxone. What you want to do is open up the package of the Narcan and remove the device. This is the nozzle and this is the plunger. What you want to do is position your fingers like this and insert the nozzle into the individual's nose until your fingers hit the tip of their nose, and then press down on the plunger to administer the first dose of the Narcan. As I mentioned earlier, you may have to give a second dose of the Narcan. Step 4 would be to provide further resuscitation for the individual. To do this, you're going to give rescue breaths. So you're going to lay the person on his or her back on a flat surface. Then you will tilt the chin to open the airway and remove anything that is blocking the airway. You're going to pinch the individual's nose completely closed. Then, using a protective barrier, you will cover his or her mouth and put your mouth over top of theirs and give 2 regular breaths, about 1 second each. Then you're going to breathe again and give 1 breath every 5 seconds. If trained and the person has no pulse, you'll want to begin CPR and follow the 911 dispatcher's instructions. Step 5 will be to care for this person. So you'll want to stay with this person until medical help arrives, and then if they're able to, you'll want to sit them up or put them in the recovery position. Once Narcan is administered, you're going to want to make sure that you call the Poison Control Center. Or you're going to contact the training entity, which would be the Worcester County Health Department, to notify them that you have given the Narcan.
Once naloxone is administered, call the Poison Control Center at 1-800-222-1222 within 1 to 2 hours, or contact the training entity that issued your certificate. How not to respond to an opioid overdose. Do not use ice to cool down the body. This could cause slow heart rate or arrhythmia. Do not put the person in a bath or shower. This could cause drowning. Do not hit, slap, or burn the fingers or feet. This could cause bruising, broken bones, or infection. Do not give the person a drink or induce vomiting. This could cause choking to death. And do not inject the person with cocaine, salt water, milk, or an epinephrine. This could cause high blood pressure or infection. Opioid overdose prevention tips. Keep all medicine in a safe place, such as a locked cabinet. Properly dispose of expired or unwanted medications. Take only medicine prescribed for you and only as directed. Never share your prescription drugs with anyone else. If you have breathing problems, check with your doctor before taking opioids. And never mix pain medication with alcohol, benzos, sleeping pills, muscle relaxants, anti-nausea drugs, other opioids, or illegal drugs. Prevention tips for those who may be using drugs. Don't use alone. Make an overdose prevention plan and share it with someone you trust to give you naloxone if needed, and make sure they know where to find the naloxone. If you have not used opioids in a while, your tolerance will be lower and risk for overdose is greater, so use less opioids than you normally would. You are also at greater risk for overdose if you have overdosed before. Always keep naloxone on hand. Call Maryland 211 for help. Get treatment for drug dependence or addiction. Seek professional help if you are depressed. Laws to protect you. The Good Samaritan Law. A person who seeks, provides, or assists with medical assistance for another person experiencing an alcohol or drug-related medical emergency cannot be arrested, charged, or prosecuted for possession of a controlled dangerous substance, possession or use of drug paraphernalia, or providing alcohol to minors. Calling 911 will not affect your parole or probation status. Immunity, individuals and medical providers. An individual who administers naloxone to an individual believed to be experiencing an overdose shall have immunity from liability under Article 6-603 and 5-629 of the Courts and Judicial Proceedings article. You cannot be held liable for a good faith attempt to help someone. Suggested resources for family, friends, and loved ones of opioid users. To obtain your free Narcan kit, complete the SurveyMonkey by clicking on the link below. You will be contacted to arrange a date and time to stop by the Worcester County Health Department located at 6040 Public Landing Road in Snow Hill, Maryland. All current social distancing guidelines will be followed during the pickup. Please remember to wear your mask.